Can undocumented immigrants get emergency Medicaid care? Have you ever wondered if undocumented immigrants can access emergency medical care in the United States? This is a vital topic, especially for many Latino households navigating the healthcare system. Let's break down how emergency Medicaid works and what it means for those without full immigration status. Undocumented immigrants are not eligible for complete Medicaid coverage or other federally funded health insurance programs. However, they can receive emergency medical care through Emergency Medicaid. This program reimburses hospitals for emergency services provided to individuals who meet Medicaid income requirements but do not have eligible immigration status. This includes undocumented immigrants and some lawfully present immigrants who cannot access regular Medicaid. Emergency Medicaid covers treatment for medical emergencies. Each state defines what constitutes an emergency, but it generally includes conditions that pose an immediate threat to life or health. For example, emergency labor and delivery services are often covered. The specifics of what qualifies as an emergency can vary by state. Some states may have broader definitions that include certain chronic conditions when they become acute emergencies. Undocumented immigrants can also access emergency care under the Emergency Medical Treatment and Labor Act. This law requires hospitals to provide life-saving treatment regardless of immigration status or ability to pay. Emergency Medicaid helps hospitals recover costs for such care, ensuring that individuals receive necessary treatment when they need it most. It is important to note that Emergency Medicaid does not cover routine or preventive health services. Undocumented immigrants usually have very limited access to health coverage beyond emergency care. Some may find limited primary care through federally qualified health centers. Those with sufficient income might also purchase private insurance without federal subsidies. For Latino households in America, Emergency Medicaid acts as a critical safety net. It helps undocumented immigrants who face significant barriers to healthcare coverage. However, this coverage is limited to emergencies and does not provide comprehensive health insurance or access to regular medical care. This reality shapes how many Latino families navigate healthcare, often relying on emergency services when no other options are available. Understanding these details can help families make informed decisions about their healthcare options. If you or someone you know is in need, knowing about Emergency Medicaid can be a lifeline in times of medical crises.